Hey everyone, welcome back to the channel. I'm Helena Strauss and living with multiple myeloma. And today we're going to talk about something that might sound a little unconventional for cancer patients and their caregivers: medical marijuana. I know for many of us, the word marijuana might bring up images of something illegal or recreational, but for cancer patients, it can actually be a really helpful tool in managing some of the toughest symptoms and side effects of treatment. And it also helps improve our quality of life. If you saw my other video on chemo, nausea, and vomiting, which I will link to below, you know that nausea and vomiting start in the brain in the chemoreceptor trigger zone. This is why, in addition to being prescribed a drug like Zofran or its generic ondansetron, you also might be given a script for something like prochlorperazine or Ativan, which are typically used for nervous, emotional, and mental conditions like anxiety. Now, many cancer patients or their caregivers hesitate to even consider marijuana because of its history. But let's be clear, medical marijuana, also known as cannabis, is different. It's about delivering it and using it for therapeutic benefits. And the good news, you can use it without feeling high. If you're feeling hesitant, let's put things into perspective. Think about every single prescription medication you take for your cancer treatment or to manage side effects. Guess what? Selling those on the street is illegal.
No.
And medical marijuana, when used under a doctor's guidance, is just like any other medication you take.
Yeah.
It's prescribed, its strength is controlled, and when used as directed, it can be just as safe and effective. The key here is getting a prescription from a qualified healthcare provider. In my case, it was my palliative care doctor. And palliative care doctors are specialists who focus on treating patients with serious illnesses at any stage, not just the end stages. They can assess your individual needs and determine if medical marijuana is right for you or your loved one. They'll write you a prescription with specific instructions and dosages, just like any other medication. This, for example, is what my prescription looked like. And just like with other drugs, I brought my prescription to a pharmacist. But instead of being at a big chain drugstore, the pharmacist worked at a dispensary. So let's break down the details of a prescription. The first line is the doctor's overall recommendation. My doctor recommended a high CBD formula 3 times a day. CBD, or cannabidiol, is one of the main compounds in cannabis. It's known for helping with things like pain, anxiety, and sleep. And most importantly, it doesn't have the psychoactive effects that make you feel high. Line 2 tells you the formulations or different ways you can take the medication. Things like gummies, tinctures, cookies, creams, and ointments. In the third line, my doctor specified I should only use it topically on my skin and orally by mouth. And as a multiple myeloma patient, it was important for me to avoid smoking to protect my lungs. And then finally, this last part says I should be taking the medication as needed, PRN. So when my nausea was gone and I was able to eat, I did not need to continue with the medication. Now, let's talk about THC. THC is the compound in marijuana that does have the psychoactive effects and can give you the sense of euphoria or high that it is known for. But it is also incredibly helpful for certain things, like affecting the chemoreceptive trigger zone when you are battling nausea and vomiting and have no appetite. During my initial cancer treatment, I struggled with nausea and lost a lot of weight to the point where I was anorexic. The standard anti-nausea meds like Zofran and Ativan in my case helped a lot with retching and vomiting, but I had no desire to eat. And within days of using a 20-to-1 THC to CBD blend, my appetite started to come back. I mean, it was amazing. And it only took me a couple of months to get back to a healthy weight where I can endure the rest of my treatment. My prescription actually had 2 different ratios of THC to CBD, a 1-to-1 ratio and a 20-to-1 ratio. And this gave me options depending on what I needed. And when I contacted the dispensary, which is where you get your medical marijuana, I received counseling and had my options laid out. I personally decided to go with a tincture, which is a liquid you take under your tongue using a dropper. And the droppers have clear markings and measurements, so I could start with a very small dose and gradually find the right amount that worked for me. And here's something important. I never got high. I personally never felt high, even with the medication that contained the THC. And in fact, it is quite common not to feel much of a high when taking marijuana orally. And this is because our liver processes the THC before it even reaches our bloodstream, unlike when you smoke it. So if this is a concern for you, understand that the oral route is always available to you. I know if you're new to this, it might all sound a little confusing and even scary. You might have heard stories about people who misused recreational marijuana and had a bad experience. But overusing medical marijuana is really no different than overdoing anything else. Too much of anything can make you feel unwell. Think of medical marijuana as just another medicine. If you treat it with respect and use it under a doctor's supervision as prescribed, it can be a real benefit, just like all your other medications. It can be incredibly helpful for managing nausea, lack of appetite, anxiety, sleeplessness, and even pain. So hopefully in the future, getting your medical marijuana will be as simple as picking up any other medication at your local pharmacy. But for now, you'll likely need to go to a licensed dispensary if your state has a medical marijuana program. And if your state does not have a medical marijuana program, please remember that CBD, the non-psychoactive part of cannabis, is legal in all 50 states and readily available online. I'll put some helpful links down below in the description so you can learn more. Ultimately, treatment decisions are personal ones, and you should discuss with your doctor and family. But I hope this video has helped demystify medical marijuana just a little bit and shown to you that it's a potential option for managing some of the challenges that come with myeloma. If you found this information helpful, please give this video a thumbs up and subscribe for more information on living with multiple myeloma. Until next time.